And so for those of you who don't know me, my name is Laura Molu. I'm a lead physical therapist at Cadlick, and I've been there since 1997 and have been working with people with Parkinson's for close to the last 30 years, but I've been really focusing on Parkinson's disease for about the last 11 years. And I'm very blessed to have working with me Jenny Davis, and you're going to be lucky to see her speak towards the end. I always have to go first when we talk because she's a very hard act to follow. So she's a speech-language pathologist. She's the only person since I've been at Cadlick for 20 years that I went to my manager about and said, we need to hire this person, please recruit her. And I'm blessed that they did. We have a pretty good-sized team at Cadlick that are all specially trained and certified to work with people with Parkinson's disease. And this is 4 of us. We were fortunate enough to go to the World Parkinson's Congress down in Portland last year. And does anyone know who the lady is that so graciously took her picture with us? Anyone have any ideas? That is May Ali. She is Muhammad Ali's daughter, and she was one of the keynote speakers. Wonderful poet. So today I'm hoping that by the end of our talk you'll be able to better identify the signs and symptoms associated with Parkinson's disease. So I'm hoping that you will be able to understand kind of the benefits of being diagnosed. So if you do have Parkinson's, it's good to get diagnosed so you can get some treatment. And then also we'll talk about some of the various treatment options that are available. So I'm going to give a quick overview of Parkinson's disease. I'll define it. I'll talk about the definition, the incidence, the diagnosis, how that's made, signs and symptoms, and causes. So Parkinson's disease is a progressive neurologic diagnosis, and it occurs in about 1 out of every 100 people over the age of 60. And it's typically diagnosed in people when they're in the 6th or 7th decade, so in their 60s and 70s, but about at least 77% of the people with Parkinson's are diagnosed before the age of 40. And in rare cases, there are children that actually get diagnosed with Parkinson's disease. So you can have a diagnosis of Parkinson's in grade school or in high school. It's rare, but I know of 2 cases in the Tri-Cities, at least right now. And that's usually definitely associated with a particular gene. So in Parkinson's disease, the brain stops producing a neurotransmitter called dopamine. And dopamine is important to help us do kind of smooth and coordinated movements. And the thing that alarmed me when I first started learning about Parkinson's was you don't even really start to get classic symptoms where you're diagnosed with Parkinson's until you've already lost about 80% of those dopamine-producing cells. And so the Parkinson's is actually there and it's progressing in people, but you may not have the classic signs and symptoms. Does anyone know, anyone can raise their hand, does anyone know what some of the early symptoms are of Parkinson's before you have some of the classic symptoms that get diagnosed? What do you think it is?
I think it has something to do with eyesight. I'm going to take a guess at it.
So vision, it can be affected with Parkinson's, but sometimes that's not necessarily one of the early symptoms. But good guess. Yeah, tremors, and that's kind of one of the primary symptoms. Anyone else?
Smell?
Yes. So isn't that interesting? So not in everybody with Parkinson's, but in many people with Parkinson's, they will state that they had kind of lost their sense of smell or had a reduced sense of smell many, many years before they were ever diagnosed with Parkinson's. And there are other reasons why you can lose your smell. So if you don't have good smell right now, it doesn't mean that you're going to end up with Parkinson's. But it would be something that I would just kind of share with the doctor and keep an eye on. And any other ideas in terms of what some of the early symptoms are? Yes? That is one of the symptoms of Parkinson's for sure. Small writing, small handwriting. But there's at least one other symptom. What is that?
Restless leg.
There you go, excellent. So there's something called REM sleep disorder. So rapid eye movement is REM. REM sleep disorder is something that can happen in people where you're kind of having active, vivid dreams, you're acting your dreams out, you're talking maybe when you're dreaming, or your arms or legs are moving. And so that can happen, again, not in everybody that has Parkinson's, but there are many people that have Parkinson's that get those symptoms well before they get diagnosed. So good job. Sounds like you guys know a lot about Parkinson's, which is good. So the incidence of Parkinson's, in America, they estimate that there are probably about 1.5 million people living in the United States that have Parkinson's right now. And that is more than the combined number of people in the United States that have multiple sclerosis, muscular dystrophy, all the different forms of muscular dystrophy, and also Lou Gehrig's disease, or ALS. And every year there's probably about 60,000 people in the United States that are diagnosed with Parkinson's. And that does not account for the people that have Parkinson's but are not diagnosed. And that's a big reason why we're talking about this today, because we want people to be familiar with signs and symptoms. So hopefully if people do have Parkinson's, they're not suffering and they can get in and get diagnosed and get some treatment. So here's some faces of people that have been diagnosed with Parkinson's disease. Michael J. Fox in the upper left-hand corner has been very active since his diagnosis, and he was an early onset or young onset person with diagnosed with Parkinson's. He's done a lot to raise money and to help research in that area. And so worldwide, they estimate that there are probably 7 to 10 million people in the world living today with Parkinson's disease. And the number continues to go up as our population is aging. And about half of the people in the world with Parkinson's live in China. So China's got approximately 5 million people that have Parkinson's. It's a big kind of burden on their healthcare system in China. Men are more likely, about 1.5 times more likely to get Parkinson's than women. So when people are diagnosed with Parkinson's, the diagnosis is usually done by a clinical examination. So Parkinson's is a movement disorder, and so the doctors have to actually observe movement in order to make the diagnosis. Right now, there are no clear clinical tests that the doctors can do to confirm Parkinson's disease. So I think that's kind of hard for people sometimes if they walk into the doctor's office and the doctor looks at them and tells them that they have Parkinson's, right? Sometimes they're questioning, like, how does the doctor know that I have Parkinson's disease? The doctors are usually very good, generally, about picking up the signs and symptoms, especially a neurologist and particularly a movement disorder specialist. They specialize in movement disorders, which Parkinson's is one of the largest of the movement disorders. And they're pretty good about honing in on the correct diagnosis. Sometimes the doctors will order like an MRI test or blood test to rule out other diagnoses just to kind of help confirm the Parkinson's disease. Now we're getting into the signs and symptoms. So I'm going to ask the audience again. I think you guys have already mentioned quite a few of the signs and symptoms of Parkinson's, but can anybody tell me there's 4 hallmark signs and symptoms of Parkinson's? And if you feel free to raise your hand. Yes?
Loss of hearing and a slower speech pattern.
So slowness. And so we would say that hearing not so much, but slowness in movements in general is really the hallmark sign and symptom of Parkinson's. We call it bradykinesia, which just means slow movements. And that can be slow movements that affect speech, and it can also affect your movements, your walking. And any other symptoms? I know.
I think a resting tremor maybe.
Perfect, yes. So a tremor is present in some people, not everybody, but resting tremor particularly.
My daughter had a symptom. She at one point at the table, she kind of shake her head back and forth.
And she has not been diagnosed with Parkinson's, has she? There are a lot of different movement disorders, and some of them can result in some shaking of the head. And that's where, if she has a good neurologist or movement disorder specialist, they can help to diagnose her if she hasn't been diagnosed. Yes?
Posture.
Yes, so posture. So a lot of times people can have stooped posture or flexion posture, and that's associated with rigidity, which is one of the 4 hallmark symptoms. And then there's one more. Yes?
One's gait, how we walk.
Yes. I mean, I would say that walking is one of the key things that doctors are going to look at to help diagnose. And go ahead. Drooling can happen as well. The 4th one is really hard. Go ahead. Yeah, the tremor is one of the hallmark symptoms. So, and I'll kind of go through these again, but the last one is impaired balance. It's kind of harder to observe, but people with Parkinson's are 5 times more likely to fall than somebody that does not have Parkinson's. So I listed these up here just to kind of review. So these are the 4 primary symptoms of Parkinson's. So it's tremor, rigidity, bradykinesia, or slow movements, and impaired balance. And you don't have to have all of these symptoms in order to get the diagnosis of Parkinson's. So you need to have at least 2 of them present. And usually when the symptoms first appear, they usually appear on one side of the body first. And usually the symptoms are relatively mild and they're intermittent, meaning that they're not there all the time. They kind of come and go. I've had some patients in the past say, my family doesn't believe I have Parkinson's because my tremor's not there all the time. It kind of comes and then it goes, so they think I'm faking it. It's very common with Parkinson's for things to kind of come and go like that and for the symptoms to vary a bit. As the disease progresses, because it is a progressive disease, those symptoms can become more pronounced and more persistent. So I'm going to talk just briefly about the tremor. Again, the tremor is more of a resting tremor. It's present when you're sitting still, more likely. Once you get up and start moving a bit, move the arms and legs, then the tremor tends to lessen or go away. And these tremors tend to worsen with stress, and it doesn't have to be much stress. So when I'm doing an evaluation on a person and they're in there, and sometimes if I just ask them what their name is or what their date of birth is, that's enough stress to kind of get that tremor to kick in. And it's really important to note again that tremors are not present in everybody that has Parkinson's. So there are many people that have Parkinson's that do not have tremors. So tremor does not necessarily have to be present in order to be diagnosed. I think the people that do not have the tremors tend to get sometimes a delay in getting diagnosed because it's not as obvious that they have Parkinson's. And there's also a lot of other conditions that cause different types of tremors. So just because somebody has a tremor doesn't necessarily mean that they have Parkinson's disease. It's really important to get to a doctor and have the doctor kind of assess those tremors to try to figure out what's going on.
Is it hereditary?
Rarely.
Is it hereditary?
Yes, is Parkinson's hereditary? In rare instances it can be, but that is not the norm. So for the large majority of people that have Parkinson's, they may not have any family history of Parkinson's, and it doesn't necessarily mean that their children or grandchildren, offspring are going to get it. So, yes?
Is it familial?
There are certain forms of Parkinson's that can run in families, but again, it's rare. Yes?
What disease or illness is most often misdiagnosed as Parkinson's?
I don't know the exact, in terms of research on that, but I would say that sometimes an essential tremor can be very similar to Parkinson's disease, and so sometimes it takes a little time for the doctor to figure out what it is. Did you have any ideas of something at all?
No, I was just wondering if there is something that appears like Parkinson's, but in fact is another disease.
You think of it?
Essential tremor sometimes can, people will self-diagnose themselves with Parkinson's sometimes if they have an essential tremor because they'll think they have tremor, must mean there's Parkinson's. And one of the main differences is that Parkinson's tends to be a resting tremor. When you're not moving, that's when the tremor happens. Essential tremor is more of an action tremor. It might be present when you're resting also, but there's there's a difference. There's a huge difference and a huge difference in treatment. Most of the time, neurologists are pretty good about filtering that out. There are diseases, just as with any disease, you think it's one thing and it turns out that it's another. That's why it's important to go to the doctor, not try to self-diagnose, and make sure that you share all of your symptoms with the doctor. Even if you think that it's not necessarily relevant, well, maybe this really doesn't matter. Well, let the doctor know, give them all the information so they can hopefully come to an accurate diagnosis, whether it's Parkinson's or something else.
And go ahead.
Lyme disease can mimic Parkinson's.
Okay, so Lyme disease. Lyme disease can mimic
And other conditions too. It can be tricky. Neurologists have a difficult job sometimes coming up with a diagnosis, and sometimes they might suspect something, but they may need to watch it over some time or see how it's responding to different medications. And so it's hard as a patient to kind of wait, but I know that they don't want to jump on a diagnosis that may not be inaccurate, so sometimes they need to kind of wait and watch a little bit to get a more accurate diagnosis.
And sometimes they want to rule out other things also. So although Parkinson's cannot be diagnosed, for instance, by having MRI or a CT scan of the brain or of the spinal column, the doctor might order that in order to rule out other things, okay? If it's Parkinson's, then they won't see it on the MRI. So, usually you think they're looking for something. Well, they're looking to rule out other conditions, so that's where some of that diagnostic process comes from.
Is there a test for Parkinson's on the dopamine level? Everybody has a level they start out with and they develop later because the dopamine levels go down. Is there a test for what level you have versus a wide spectrum of people?
Did y'all hear the question? Okay, yeah. Is there a test for dopamine level? And I think the answer is
There's no test
No.
that's typically done. There is something called a DAT scan that can kind of look at that area of the brain that's affected by Parkinson's, and sometimes some of the doctors will order a DAT scan to kind of help differentiate between maybe an essential tremor or Parkinson's, so they can kind of see how much of the area of the brain has been affected. But I don't know in terms of actual, unless they're doing some research or something, I don't know of any particular test where they're looking for that. Alzheimer's, the question was, do Alzheimer's and Parkinson's run hand in hand? They're both neurodegenerative problems, and they're similar in some ways, but they're also different, and so they're really two different diagnoses. In rare conditions, some people can get both diagnoses, but that's rare. So I'm going to go ahead and finish up just to make sure that I have some time for Jenny to talk here. So rigidity causes kind of a flexed posture, and it can cause some cramping in the muscles. And again, the bradykinesia, or slowness in movement, sometimes that can result in a lack of associated movements or some of the automatic movements that our body does, such as blinking our eyes or swallowing so we're not drooling, or swinging our arms when we're walking. And it can make it more difficult to get in and out of bed or out of a chair or walk. And sometimes it can result in something called freezing or start hesitancy, where you're trying to get up and move, and it's hard to get those feet going. It's hard to take a step. And that can happen sometimes if you're trying to turn or go through a door in some people. Medications and therapies and surgeries can be helpful to treat most of these signs and symptoms of Parkinson's. And then impaired balance is the fourth of the main primary symptoms of Parkinson's. And the impaired balance occurs because you get a loss or an impairment of postural reflexes. So with us, if we're starting to lose our balance or if we're shifting a little bit, we can make a quick correction and without even thinking about it. But in Parkinson's, you start losing some of that. And so it may cause people to feel unsteady or list to one side or the other. And eventually, as the disease progresses, it can result in falls. So unfortunately, impaired balance is not easily treated with medication or with surgeries. So those don't tend to help the balance problems as much. as it does some of the other symptoms. But if you do have impaired balance, the physical therapy can be helpful, and we can teach you some techniques to be able to move around a little bit easier and safer.
Tai Chi can help a lot.
Tai Chi is an excellent exercise. We have a couple of Tai Chi classes that we teach at Cadillac by Dave Goring, and Tai Chi had been researched extensively, and it's been shown to be an excellent exercise.
And you can sit on the chair and do it.
Yes, exactly. Also, Parkinson's can cause some secondary symptoms, and so you can have problems with bowel and bladder, speech and swallow, fatigue, mood and memory. Sometimes depression and anxiety can increase in Parkinson's. You can have difficulty with sexual function, low blood pressure, and also sleep. So with sleep, sometimes you may be tired during the day and then have difficulty sleeping at night. And again, causes of Parkinson's disease. Despite extensive research, we still are looking for a cause for Parkinson's disease. The research has come up with approximately 17 different genes that are associated with Parkinson's, but if you take people with Parkinson's and test them for those 17 genes, there are many people that don't have any of the genes at all. So there's not a clear link in all cases. They do know also that there are certain exposures to toxins can bring on Parkinson's. Usually that if you have a heavy dose of a toxin, that can kind of bring on those symptoms a little more quickly. It doesn't happen often, but there's certain medications, illegal street drugs, I should say, that can do that kind of overnight. Or if somebody has a really heavy dose of a pesticide, they can also develop Parkinson's overnight. So it's largely thought by, I think, a lot of doctors and researchers that many people may have a genetic predisposition. And then if that kind of leaves them a little bit more susceptible, so then if they have some exposure to some toxin, it can bring on the Parkinson's. Yeah. Many of the pesticides are neurotoxins, and so they have found that there are pesticides that are associated with Parkinson's, some herbicides and pesticides both. I don't have the specific names right now of the different pesticides because there are many different pesticides and herbicides, but the research or the epidemiology has shown that there are particular ones that can be implicated in Parkinson's, and especially if you have the exposure of both of those combined. Yes?
How does it affect bowel and bladder?
With bowel and bladder, that's a good question. A lot of times people will have early symptoms of constipation, which is very common as we have more birthdays than most of us. So just because we have that doesn't mean that we're going to have Parkinson's, but that can be an early symptom. And then also with the bladder, you can have more urgency where you're having to go more frequently, or you may not make it to the bathroom on time. So I'm going to talk a little bit about the treatments of Parkinson's. Medication is kind of the hallmark treatment for Parkinson's disease, and there are many different Parkinson's medications that can help you to move easier. And it really, for people that have Parkinson's, it becomes kind of a necessity to be on some medications. And the doctors can help with kind of managing those medication levels. So sometimes, and then I was going to talk a little bit about why symptoms or why the Parkinson's sometimes can get delayed in terms of being diagnosed. I think sometimes people that have Parkinson's may not recognize that their body's changing, and I see that frequently with people with Parkinson's. They may not notice that they're walking differently, or that their posture is more stooped, or that they're not speaking as loudly. And so that may, if they're not aware of it, they're probably not going to bring it up to the doctor unless a family member does. And also some of those symptoms can be just attributed to normal aging. When we get older, we kind of tend to slow down. Sometimes our posture is a little more rounded. With Parkinson's, it's going to be more pronounced. Some people may be fearful of getting the diagnosis, so they delay going to the doctor because they just don't want to hear that they have Parkinson's. And then for some people, they don't want they may feel that there is some stigma in terms of getting diagnosed. Also, other reasons that it may be delayed sometimes, I think, are that doctors sometimes don't get a chance to see us move very much. So I know when I go to the doctor, I have a medical assistant take me back, they weigh me, they take my blood pressure, I sit in the room, the doctor comes in, does the exam, and then leaves. And so frequently they don't really get to see me walk or get in and out of a chair. And those are kind of the movements that sometimes will help a doctor realize if somebody has Parkinson's. And so with a lot of people, it's not unless a tremor is present that the doctor kind of picks up that there may be some indication of Parkinson's. And so if you suspect Parkinson's in yourself or in a friend or somebody that you love, what I would recommend is trying to just talk to them openly about it, try to help them seek a doctor's help in terms of possibly getting diagnosed and find out whether or not they do have that. And don't attempt to diagnose them yourself. Jenny and I have worked with a lot of people with Parkinson's, and we wouldn't even begin to try to diagnose somebody. You know, we might suspect it, but we would definitely refer that person on to a specialist so that they can come up with a diagnosis. And then just remember the importance of getting diagnosed is it's the only way you can start getting treatment. And by getting treatments, it can help to lessen the symptoms and can help to improve the quality of your life. And so again, medications are one of the hallmark treatments for Parkinson's. Some people don't like to take medications, but if you do have Parkinson's, the medications can be very helpful. And there are many different types of medications available for Parkinson's. Sinemet, or levodopa-carbidopa, is one of the most commonly used. And that medication is one that you don't want to take with protein because it kind of binds, or it competes in your gut with the Sinemet, and then it's not as effective. And the doctors, again, have to frequently monitor. So this is a progressive disease. Things change over time. Really important to kind of get into or have regular appointments with the doctor so they can kind of monitor the medication levels. They can increase doses if needed, or they can increase how frequently you're taking it to reduce the symptoms. Yes?
I'm a Sinemet taker, and I didn't know about it, not taking the protein.
I mentioned that because a lot of people don't know that. You know, you get medication and they give you this long sheet, and unless the doctor tells you or the pharmacist kind of stops, and sometimes they may mention it, but it's easy to forget everything the doctors are telling you. But I would read that sheet, and it may vary. I would talk to the doctor and the pharmacist to find out timing in terms of the protein. I'll let Jenny speak to this.
It's generally half hour before you eat or 2 hours after you eat if you're eating protein. So if you are taking Sinemet or carbidopa, levodopa, and you're having a big old plate of bacon and eggs in the morning and you take it at the same time, it's just not going to be as effective. There's not going to be a drug reaction that is going to harm you, but you're not going to get the benefit of the medication.
About half an hour to an hour.
Yeah,
Right,
about
exactly.
half hour or so before you eat, or 2 hours before, whatever. Just give it at least half an hour before you eat. That's if you're eating protein. Now, if you're going out and you're having a salad and there's not any protein on the salad, then you don't need to worry about it, okay? It's that protein piece that just competes in your gut, as Laura said. And the medication will lose. Your body will absorb the protein, but it'll absorb it from your food first. So you just want to try to time it right. And that's if you start noticing that your medication is not as effective, you want to let your doctor know, but also ask yourself, when are you taking it? Did I all of a sudden am I taking my medication with breakfast, lunch, and dinner, and I wasn't before? That might be part of the issue. Yeah.
One of the things that you didn't mention, and I know this because I have a long history of taking disability claims. A long time ago, certain psychiatric medications, phenothiazines, would cause Parkinson's, and so they would give this medication with that particular medicine. Now, whether they still do that or not, I don't know, but I do know that when I was taking disability claims, that they did that, as well as some of the major thorazines like arrhythmias.
Yeah, thank you for mentioning that.
A lot of times it gets to the point where it really looks like a real bad case of Parkinson's.
There is kind of medication-induced Parkinsonism.
Exactly.
Yeah. And it's usually with some of the psychiatric medications that we see that.
And that's, there's a fine difference in something that Laura just said, Parkinsonism. There's Parkinson's disease, and you might see a diagnosis of Parkinson's disease, you might see a diagnosis of Parkinsonism. Sometimes there will be a diagnosis of Parkinsonism, and correct me if I'm wrong on this, if the doctor's not absolutely positive or they're seeing the signs and symptoms of Parkinson's disease, so they're calling it Parkinsonism. It very well may be. But sometimes if there are medications that induce similar symptoms, it might look like Parkinson's disease, but actually it's just the medication giving you symptoms which we would say look like Parkinson's, okay? So it can, adding to the difficulty of diagnosis at times. So,
Thank you. I'll kind of wrap up here quickly so I can get to Jenny. So people differ in terms of their responses to the medications. Just like there are so many differences. If you look at one person that has Parkinson's, they may look very different from another person that has Parkinson's. So lots of good medications, though, to help with a lot of the different symptoms. And the ultimate goal with the medications is to get the most relief or to reduce the symptoms as much as you can with having the least amount of side effects. I'm going to just talk, there are several different surgeries for Parkinson's. I'm going to mention one surgery because it's one that's probably most widely used, and that's called deep brain stimulation, or DBS surgery. And this shows kind of an electrode that's put down, it's a very fine wire that's put down into the brain to help stimulate a certain part of the brain to reduce symptoms. And it's operated on a battery. The battery is usually connected by wires and put down in the chest underneath the collarbone. And this is usually often used with people, not everybody's a candidate for this, but it's often used kind of in the middle stage of Parkinson's after people have had the Parkinson's for a while, or when the medications are just not being effective enough to reduce the symptoms. And then, last but not least, therapies. Therapies are the third thing that can also help Parkinson's disease. And it's really important to get started on the therapies early. This is something that's changed more recently. The doctors are starting to find out that as soon as people are diagnosed, they should send them over to start some therapies for the Parkinson's. And I think it's been helpful because it can kind of help to slow down some of the adverse problems that can occur if you have Parkinson's. And it can empower you, and you can kind of learn these exercises earlier so that you can empower yourself to help reduce some of the symptoms of the disease. So there's physical therapy. We work on large movements. There's a program called LSVT Big, and also Power Moves. Those are 2 certification programs that therapists can go through, and there's specific exercises with each of those. Occupational therapy can also get certified in those 2 things. If you are seeing a therapist for Parkinson's, you really want to make sure you're in with somebody that's specially trained and very knowledgeable about Parkinson's because it's a complex disease. And I'm going to turn the mic over to Jenny now. She's going to talk a little bit about speech therapy. And thank you so much for your attention.
all right. You want to trade spots there? Okay, can you hear me okay? I have a different microphone on. I don't like to hold the mic because I might throw it or something. All right. I'm Jenny Davis. I'm one of the speech therapists over at Cadlick. And in addition to seeing itty-bitty little kids, I also see adults with Parkinson's. I was diagnosed with Parkinson's in 2007, and I was 41 at the time, so you can do the math yourself. And there, a lot of what you're talking about as far as what are the causes and what could it be and what tests. Oh yeah, been through the gamut of them because they weren't looking for that at age 41. So a lot of things were ruled out until finally that was the diagnosis that I received. And it was at that point after, my voice started to decline very, very rapidly. And as a speech therapist, I didn't even realize how bad my voice had gotten. I have to apologize today. I'm getting over bronchitis, so I can't blame it all on Parkinson's right now. But I went through voice therapy, and it was after I went through voice therapy that I thought, well, I can use this for something good. I can go ahead and get certified and trained in working with other people with Parkinson's disease because I get it. So it was probably one of the best professional decisions I've ever made. So speech therapy is very helpful for people with Parkinson's disease because one of the things that occurs is the voice will tend to decline in loudness. voice will get quieter, quieter, quieter. You won't think your voice is getting quieter because you're still putting in that same effort, maybe even more effort than you used to, but you're not getting that same bang for your buck, okay? The same amount of effort that you put in for most of your life, all of a sudden is not enough. So the voice gets quieter. Tend to have less inflection, become more monotone voice. If y'all think of in high school or college or some lecture you went to where there was a teacher that just spoke like this the entire time and it was very, very monotone, and you wanted to fall asleep, you don't want that, okay? You want to keep that brightness in your voice and work on inflection, because Parkinson's will try to take that away, all right? The changes in your voice also can tie in with changes in swallowing. All right, the muscles that we use for swallowing are many of the same muscles that are used when you speak. All right, if you all go ahead and put your hand up to your throat, find your Adam's apple. Okay, everybody got it? Now swallow and feel what it does. Bloop, boop. Did you feel that? Up and down. Okay, that's muscles. As you swallow, those muscles are moving your larynx. Well, you use those same muscles when you're speaking. Okay, so if your voice is becoming weaker and you're not using the muscles quite like you should, and Parkinson's is impairing those muscles, it can also impair your swallow. So when you target voice, when you have voice therapy, for instance, it actually helps with your swallowing also. Okay, so there's this added benefit. It doesn't guarantee you're not going to have problems, but it's sure better than doing nothing. Okay, speech therapy works also on assessing cognitive if you're starting to have difficulty with memory, with word finding, which, again, this is another one of these. If that's happening, it does not necessarily mean you have Parkinson's. Sometimes we just forget things as we get older, okay? But we can look at that and help with it. Two of the programs that we use, LSVT Loud and Speak Out, are two therapy programs that are specifically designed for Parkinson's disease. I'm certified in both. We have several other therapists that are certified in both of those programs. We tend to use Speak Out a little bit more because, well, there's a workbook that goes with it, and the patient has the workbook, which is very helpful. But either of those therapies are very effective, and there's a lot of research to show the support for that. So, what are you going to do about it? Let's say you've been diagnosed with Parkinson's, okay? Or your friend, your loved one. What are you going to do about it? You have a life to live, okay? You have things you want to do. So, I see some faces out there that I recognize as people who have gone through voice therapy with myself or with one of the other therapists at Catholic, and who maybe now are part of what we call the loud crowd. That's and we are loud. Ask everybody else in the healthplex. If you are currently in one of my voice groups or currently going through voice therapy, don't do this for a minute, okay? So this is for everybody who hasn't done it before. So y'all know who you are. Shh, don't give it away, all right? So you'll be able to control, okay, because I don't want to, all right. Okay, so I want you all to say ah for me. We're going to say ah for like 5 seconds, okay? Ready? Everybody who's not in the voice therapy group, ready? Ah. 3, 4, 5, stop. All right, now I want you to do it with intent, all right? I want you to say ah with intent. Still, my people don't say anything yet, okay? All right, so now you're going to blast it out a little more with intent, all right? Put some oomph behind you. Ready? 5 seconds. 3, 4, 5, stop. Good. Okay, now we're going to do it again. And everybody who's in voice therapy right now, do it with them and show them how to do it, okay? Okay, you ready? 3, 4, 5. Okay, did you hear people who were a little louder than you were? Okay, match them. See, I love it when I can make my Parkinson's patients the model for loudness, okay? All right, so whoever was that loudest person that you heard, you have to match them now. Are you ready? 5 seconds. Ready? Awesome. This is just one of the many fun things we do in our club. Okay, so we're going to do another one. We're going to add some movement in just a minute, but not quite yet. So now we're going to do something that's called a glide. Again, people who've been in the group, shh, don't give it away for a moment here, okay? So we're going to start not super low, just at a comfortable loudness. And I'm going to have you go up, okay? And then at the top, you're going to watch me. They're used to watching me. I'm like a control freak or something, okay? Don't stop till I stop you, all right? And then you're going to breathe, and you're going to start at the same place that you stopped and come back down, okay? So if you've been in the voice therapy, don't do it this time, okay? Ready? Everybody? Good. Ready? Excellent. Okay, now if you've been in voice therapy, go ahead and do it with them. Show them how to do it. Ready? Good. Okay, so those two exercises, now do them 10 times in a row, 4 times, 2 times a day for 4 weeks, and then you can do them 1 time a day forever, right? How long do you have to do these exercises if you have Parkinson's disease? Well, as long as you have Parkinson's disease, okay? If you don't, then I'll be the first to tell you can stop now. But we want to add some things together, okay? So we're going to get you moving and get your voice going, because when you add movement with talking, you've all heard about the person that they can't walk and chew gum at the same time? Okay, well, he can't walk and chew gum at the same time because when you're walking, you have a motor skill going on. Okay, and he's chewing gum. Now he has 2 things going on, and they're competing for his attention. So, since that's probably not necessarily the most real life situation for all of you, think about when you're going for a walk with someone you care about, and you're having a conversation as you walk. Okay, if you have Parkinson's and you're walking and you're talking at the same time, your brain is going to be focusing more on one or the other. I always hope that it's going to focus more on walking, because as much as I want you to have a loud voice and be able to call for help if you fall, I would rather you not fall, okay? So we're going to add some movement to that loudness that you had, all right? So everybody raise your right hand. You're going to mirror me, okay? I'm going to raise my left hand. I do know it's my left hand, all right? If your elbow is bent, unless you have a reason why you cannot do it, I want you to straighten it out. So you're reaching like the tallest point on the shelf, all right? So now when we say ah, what you're all going to do is you're going to go ah, and I want fingers outstretched with intent. This is a key word that we use in voice therapy with Parkinson's. You have to use intent. You have to use intent because if you're just trying to go with automatic doesn't work anymore. Okay, so hands down. We're going to say ah. We're going to say for 10 seconds this time. I promise we won't do this a lot, all right? All right, so you're going to say ah, 10 seconds. I'll stop you. Everybody's hand out. All right? Oh, wait, now put it down. I didn't say ah yet. Okay, so we're going to say ah as you fling your hand out. Ready? Ah. 2, 3, 4, 5, 6, 7, 8, 9, 10. Stop. Good. Okay, now with your arm, don't hit the person next to you. So use whichever arm you want, but just don't whack anybody, okay? We're going to do those glides, but I want you to move your arm with it, all right? We're going to do it twice. First time will be one arm. Second time will be the other arm. So if the person next to you hit them, you have an opportunity to get them next time. Don't hit them, okay? Ready? Here's the glide, okay? Ah. Stop. Ready? I don't know, I think you can all do better than that. It's like, kind of intent, but I'm a little feeling awkward because there are a lot of people around. I want every ounce of intent you can have, okay? I want you to focus on it. You're accessing a different part of your brain when you use intent. When you just kind of go automatic, that's a different part of your brain. It doesn't work well with Parkinson's. You have to be very intentional about it. Okay, you ready? Now the other arm. Be careful. Ready? So the voice therapy, as you're doing this, you're actually raising your larynx up and down in your throat. You're exercising the muscles. When you're using that loud voice, you're exercising your muscles. You're taking a deep breath instead of these little teeny tiny little shallow breaths. You need to take a deep breath for those loud ahs. So now that I have you warmed up, we're going to put that to practice. We're going to have a loud voice. And we're going to have not only a loud voice, but we're going to use those pitch changes. Anybody want to guess what we're going to do? We're going to sing a song, okay? I see some eyes rolling at me here, all right? So this is Take Me Out to the Ball Game. Does everybody know the World Series is going on now? Okay, a year ago I had the pleasure, the privilege of being in Chicago at the same time the Cubs were playing in the World Series. Never did I think I would so quickly become a baseball fan. Okay? So, Take Me Out to the Ball Game is something that Bill Murray sings for the Cubs, or sang for the Cubs during the World Series. He sang Take Me Out to the Ball Game over the loudspeaker. I think he did it twice, once as Bill Murray and once as Daffy Duck. I won't make you do that because I'm trying to avoid the whole spitting thing, all right? So I want you to sing Take Me Out to the Ball Game with me. I'll know if you're not singing. So we're going to sing it together, all right? And then we'll do it again after that. So let's sing Take Me Out to the Ball Game. Ready? Take me out to the ball game. Take me out to the crowd. Buy me some peanuts and Cracker Jack. I don't care if I ever get back. Let me root for the whole team. If you don't win, it's a shame. And it's 1, 2, 3 strikes, you're out of the old ball game. You guys sound pretty good. Now we're going to sing it with intent, all right? Bill Murray would approve of this. There's Bill Murray, okay? So, do you see how I have it written a little bit different? I'm not going to go into exactly what you're supposed to do there. I think it's kind of self-explanatory. I want you singing with intent, all right? Look for where those words are. If you want to use a hand, if you want to count 1, 2, 3 strikes, you're out, do it. Move your body. Okay, ready? A little louder, okay? Take me out to the ball game. Take me out to the crowd. Buy me some peanuts and Cracker Jack. I don't care if I never get back. Let me root for the whole team. If they don't win, it's a shame. And it's 1, 2, 3 strikes, you're out at the old ball game. You guys are great. Bill Murray would approve, okay? So there's that fine difference between just doing something or doing it with intent, all right? Believe it or not, it's not just about the speech therapy. Everything that you do, okay? The physical therapy, occupational therapy, everything that you do in your daily life. When you have Parkinson's disease, you have to switch hands. You have to do it with intent. Because if you're relying on it to just be automatic doesn't happen so well anymore with Parkinson's disease. But it doesn't mean that it goes away forever, okay? It is something you yourself can do something about it. And that's what therapies help with. Medications give you the tools so you actually chemically are able to move like you need to. And the therapies help you take control of what you can do to improve the situation. All right? You guys have any questions?